Welcome back. The Gauteng Education and Health MECs Panyaza Lesufi and Bandile Masuku respectively were set to visit the family of a grade 7 boy learner from Kokosi Primary School who died on Thursday. The Department of Education has ordered a forensic investigation into circumstances that led to the death of the 12-year-old boy who died shortly after arriving at his Carletonville school, leading to parents storming the school demanding answers. The Gauteng Education MEC Panyaza Lesufi joins us now to tell us more about the visit. So, MEC, what was the outcome of your visit?
Thank you so much, Lisa, and thanks for the opportunity. We truly appreciate that. We felt that we owe it to the parent and also to the school, so we took along the MEC for Health, Dr. Bandile Masuku. We took the local councillor. We also took along the SGB, represented by the chairperson as well as the principal of the school, just to outline to the parents what happened. They explained to the parent that when the child arrived last week Thursday, they could see that the child was not in a good condition. They took the child to the isolation room, and the situation deteriorated, and then they rushed the child to the clinic. Unfortunately, passed on. But just because of the difficulties in breathing, I think many people assumed it was related to COVID, and therefore demanded that we intervene and act. It was within that context that we asked the Department of Health to conduct a forensic examination on the body and therefore advise us. So today we handed over the results to the family, and the family accepted that indeed it was not a COVID-related death, and that they've given the department the go-ahead not only to release the results about COVID, but also to continue with other examinations so that we can know the cause of death.
Were there any existing comorbidities, and are you at liberty to share that with us? As in, has the family given you the AOK to tell us what was the cause of death?
Not yet. I think that's the purpose. Now that we have eliminated one element of COVID, we felt that we should proceed as well, just to know what is the cause of death, and the family indeed gave us that go-ahead, and the test will be conducted tomorrow, and on the basis of that, we'll go back to the family later this week to give them the final results.
It was quite a traumatic event for those who experienced it. Have his fellow pupils and staff been provided with counselling as yet?
Yes, indeed. Fortunately, as I'm still acting as the MEC for Social Development, we have made social workers available, and the local municipality has also made social workers available. We are also assisting the family with the funeral arrangements. We're making some contribution to ensure that the family is not overburdened, and we can be in a position to assist them as well.
MEC, it was reported that you yourself were in isolation after 2 employees at the department's head office tested positive for COVID-19. So one would then beg the question, how were you then able to make the visit if you were under isolation?
Indeed, late last week, 3 of our staff members tested positive. These are people that are working closely with me in particular, because we're preparing for the reopening of schools, and on the advice of doctors and experts, I was told to go to isolation and until my test results can come back. I took a test and almost last week, and the results came back yesterday, and on the basis of the results, because they are negative, I was given the green light to proceed to do my work.
Okay. So does that, your own contact with a possible, or your own contact with a positive case, not raise concerns for you about the readiness of schools to admit learners and teachers? We've seen the fact that there are teachers who've tested positive, and some who were part of the schooling system. How are you going to ensure that you stem this?
So you should remember that the reopening of schools is not a decision of the department, it is a decision of experts in the health sector. We are dealing with a health problem, so we need to rely on health experts. And if health experts are indicating that we can open schools, and they've indicated the reasons why, we can't challenge that decision. We're just implementing that decision. And at any rate, when we observe that the situation is out of control, we will be in a position to go back to the experts and say, you got it wrong.
What would you consider as being out of control?
Well, we're dealing with children, so we're monitoring the number of learners that have been infected. And so far in Gauteng, we don't even have more than 5 kids out of the 700,000 or so that have gone back to school that have been tested positive. The 2 learners that have been tested positive have been tested because they were coming back from the community. They didn't test positive within the school premises. They were coming back from the community, and our systems managed to pick them up, and we managed to ensure that they test, and we're monitoring that situation. And all the educators as well are tested positive.
I must push you on this though, MEC. What would you consider as being out of control? We understand something like 26 schools are under the health department's watch because of these incidents. What would you consider as a point where you say we have to reverse the reopening of schools?
Well, we'll be guided by the Department of Health. We are giving them those statistics, so we don't know at what level they will say because of the number of positive cases, we must close schools. The opening and closing of schools is not in our hand. It's in the hand of the Department of Health and those that are advising us on this matter.
Okay. Thank you so much for your time. Gauteng Education MEC Panyaza Lesufi.